Good morning to everyone who has joined the call. Thank you so much for joining us today. Seeing that it's already 10 past 10, we're going to start, I think, with the session. And as people are joining or have connectivity issues and continue to join the call, we'll just monitor and allow them in. So more people will be joining as we go throughout. But I think for now, we can just get started. Just to introduce myself, my name is Chrissy Blaus, and I'm an attorney at the Women's Legal Center. Just as an overview and some context for those of you who might not know about the organization, the Women's Legal Center is an African feminist law center. We specifically focus on human rights and gender equality within South Africa. And largely part of why we're having this call today is to do a reflection on the women who work in precarious conditions within South Africa. So women who continue to work on the front line within South Africa, and how their vulnerabilities have particularly been compounded due to COVID-19. Just to say as some context and just to highlight that we know that many women work on the front line within South Africa, whether it's working on farms, agriculture, whether it's providing care work both within the home and within communities, whether it is providing domestic work within private homes, having to live in the home or live outside of the home where they work, and just women working in factories as casual workers, and what these kind of conditions come with. And we've recognized that these categories of workers either have rights that are not properly protected, recognized, and there's a lack of oversight where rights do exist. And other categories of workers actually are not recognized, don't have proper rights realization. And so this webinar will focus on how we highlight the vulnerabilities and the circumstances of these workers, especially during COVID-19, and how we build forward through feminist solidarity and how we can continue to support. Because I think one thing we have to recognize is that many of us are privileged to be able to join the call itself today, as often we see when it comes to these categories of workers, they're not able to participate. They're not able to take a day off from work to join a webinar, to join a protest, because they are so vulnerable in their working position that they have to be accountable at their workplace. And so it looks at how, as grassroots organizations, as public interest organizations, and as activists, we're able to support each other in this front going forward, and what our work looks like post-COVID-19. And so I think we can just start. I just want to do a few household rules. And that is one, all participants to please keep their videos off and to have their mics muted, just because we know that data is quite expensive and we have load shedding throughout different areas. And so network and connectivity are issues. And so what we'll ask is that everyone please have their mics muted, have their videos off. When a speaker is addressing everyone, they will have their videos on and turn it off as soon as they're done. If anyone has any questions, please feel free to put it in the chat box. I will be supervising the chat box and I'll be addressing the questions that come through the chat box to the speakers as they are appropriate. Also, please note that the session is being recorded. If there is anyone who would not like the information to be shared through the recording or posted, or a question that they've asked to be resurfaced, just in the realization of confidentiality for persons, please also you can pop me a message privately through the chat box so that I can note that you do not want to be your name or any question that you've asked to be addressed through the call or through the recording. So please feel free to let me know that as well. So those are just some of the logistics and the rules that we're going to follow throughout the call. And then I think we're going to get started immediately. And we're going to get started with Myrtle Witbooi. And Myrtle Witbooi is quite the activist within South Africa. She has a long-standing reputation in working with domestic workers. She serves as the General Secretary of the South African Domestic Service and Allied Workers Union. And I've actually met Myrtle quite a few times and have been involved with her in workshops and discussions around the status of domestic work within South Africa. And I think one thing that we've realized is that with domestic workers, and as we at the Women's Legal Center also work, we realize that there are so many intersectionalities that marginalized, poor Black women face within South Africa, because you're a domestic worker who has issues in relation to oversight and accountability within your workplace, but you're a domestic worker who might experience domestic violence within the home space and has to filter that through to work. You're a domestic worker who might experience sexual harassment within the workplace, and you're not able to report that because you're the only person within your workspace. And so we realize the vulnerable position that most domestic workers find themselves working within a South African context, but how that has been highlighted through this COVID pandemic and the need for these protections to be better recognized. And earlier this year, the WLC actually joined a case called Mashlangu, which was in the Constitutional Court. And we specifically joined this case to highlight the need for protection of domestic workers in terms of social protection, because we knew that domestic workers who work in private homes were excluded from benefiting in terms of COIDA, which was compensation in terms of occupational injuries. And so, Myrtle, we would like you to just maybe address the room today on some of the lived realities for domestic workers within South Africa, but how those vulnerabilities have been compounded by COVID-19 and what that looks like in this current climate.
Can you hear me now? Okay, good morning. Good morning, everybody. Thank you very much for inviting me. And yes, the domestic workers in South Africa, currently we are in a crisis. We are in a crisis for two things. The one is COVID-19 has exposed us to the reality of domestic workers and their suffering. Then we also have COIDA, and COIDA and COVID-19 is actually have to work together, because COIDA is actually also protecting domestic workers to be compensated, you know, when they get ill. Unfortunately, the reality in our country is that domestic workers have got beautiful laws on paper. We've got a lot of labor laws, we've got a basic conditions, we've got wage act. But what happened now, for the first time in my 50 years of dealing with domestic workers, I find myself at a stop. I find myself question the reality of domestic workers. I find myself questioning of what have we actually achieved over this 50 years, because COVID-19 has exposed how domestic workers are suffering. We find ourselves every day with phone calls, with WhatsApps of domestic workers calling us and telling us how they are suffering. We find ourselves every day with domestic workers not having food. We find ourselves every day with domestic workers not having the technology or having the smartphones or having normal phones to connect to this fund that is there for domestic workers, the Solidarity Fund. It has not reached out to many domestic workers, the 350 Rand. We find that the Department of Labor has released a statement to say out of the 1 million of domestic workers, only 19,000 has had access to the fund, the Solidarity Fund. We also find ourselves with WhatsApp coming from workers to say, but I have earned 3,000 by my employer, but here is proof that I'm only getting 1,400 Rand from the Department of Labor. So every day it has become, every day, your WhatsApp, our organizers is trying to run around to deal with this. What does Satsawu try to do? Satsawu has tried to do reaching out to some of our members. We cannot reach all our members, but what we have tried to also start a crowdfund with the help of America Women to ask us, help us so that at least we can help the most workers that are suffering. Yes, we have achieved a little bit of helping. We could assist 160 workers. We've also been assisted by Women on Farms. We've also been assisted by the IDWF. But is that really the answer to what is happening now to domestic workers? When we look at what is happening, like you were mentioning earlier in court, we find out that they say COIDA. They say it's unconstitutional. We know it's unconstitutional, but it's standing still at the moment, was unconstitutional. It has not moved anywhere. This year we decide to start working on that again. We have now signed a petition, you are all part of it, and that petition we are now going to forward to the Department of Labor and to government. We were promised that this year, March, they were going to address the issue in the cabinet meeting. When we look at the role of cabinet, there's no mention of domestic workers. So now where is Tatsawu at the moment? Tatsawu is at the moment, just this morning, I got 2 of my active members that's been dismissed by the employers because the employers cannot afford them anymore. We are standing with 75, 80 calls a day of domestic workers that are slowly losing their 5-day job and now have to do a 2-day job. We have calls from domestic workers that used to travel every day, and now they, all of a sudden the employers are scared. The employers are demanding that they now have to stay on the premises. They can't stay on the premises, they got their own family. So yes, Tatsawu now have to find a way forward. That will come later on your show. But what I'm thinking is that we are trying our best. We are appreciating all those that are helping us. But it doesn't stop us from challenging our Department of Labor, from challenging everybody. What are we doing for the vulnerable workers? How can we assist the vulnerable workers? We also find out with the last 2 days and the last 2 weeks of storms, we found our domestic workers are living in, not actually nice places, and they have been traveling every day to their workplaces without complaining. But now we are exposing to the reality. We are exposing to domestic workers that there's no income. We are exposing to domestic workers that are not having food on the table. We are exposing to domestic workers struggling with their children because the children's education is now on phones. The children's education are now in the internet. The children's education are now, so even that Tatsawu has tried to assist domestic workers with at least giving them a little bit of data, with at least giving them some SMS. And also, I need to mention that the IDWF, the International Domestic Workers Federation, has got the enormous task of trying to help domestic workers in the world. And that is also where I'm part of. They have also tried to assist Tatsawu. And so the question here is, how are we going to get the Department of Labor to act? They say that this fund of 350 Rand, it can carry on. Up to today, hardly any domestic worker has get this fund. We also have a domestic workers union in Pretoria, UTWUSA, that is having exactly the same problem. We have MAWUSA, which is the migrant domestic workers, that are having exactly. So we are teaming up now to see how can we actually speed up all that lovely labor laws that are on paper. How can we speed up that domestic workers will now get from the 350 Rand fund? Yesterday we heard that they are talking about basic income grant. I think that basic income grants come way back from Black Sass, when we have one powerful woman, Leonie, that was fighting for the basic income grant. Where is it now? Who is going to benefit? So the question is here, how are we going to get awareness? How are we going to get the SCOIDA passed? And how will we make sure that domestic workers will benefit from all this solidarity fund, from everything that's happened? So this is what I'm trying to say. Thank you very much. But I hope at the end of this, we will come forward with a positive way for domestic workers. Thank you again for inviting me.
Thank you so much, Myrtle. I think one very important thing that you've said throughout your presentation, and that we continue to work on and kind of realize and find at the Women's Legal Center as well, is exactly what you said. In South Africa, we have beautiful laws on paper, as a lot of people will say, and it provides us a sense of formal equality, yes, but that really is not what is needed within our context. What we need is substantive equality. It's equality that we see come into effect in the real life for women, not just on paper to say, oh, domestic workers are recognized, but are they recognized in their lived realities? And as you've just painted out for us, that is clear that it's not. I don't see any questions for you yet on the session, so I'm going to use my privilege as the facilitator just to ask you one question. And this is something that we've also specifically experienced at the Women's Legal Center. You've mentioned how resources access is a problem for domestic workers during this time, and especially in trying to reach government social relief protection measures. But I wanted to ask you, how have you found as a union access for domestic workers to you have been coming through? Are domestic workers still able to contact you? What are kind of creative ways that you've been able to, as an organization, keep in touch with domestic workers on the ground?
Okay, what we have tried to do, we have tried to reach as many of our members and non-members by going on media and things like that. We also tried to assist our workers with data and SMS, and then we provide all the organizers SMS, the number, the cell phone of the organization, and what we are saying to the worker, just SMS. And then you give us your number, we will call you back. So that is how we had, made access. We have so far contact over 2,000 of our workers, so that we can also, that we sometimes get assistance also to help domestic workers. But you have to be so careful. You don't want to hurt one and not. So out of the 2,000 and 3,000, we have to look very carefully what is basically the need of that worker. So currently we're also working on getting some, some parcels to workers, but domestic workers have not really benefit from the government. What we happen, we find, even when we send in names and it gets stuck somewhere between reaching them. So that is our problem. We still haven't had direct access. For the first time last week, I've made contact with the CCMA, and I must say that they are very helpful on assisting us now and bringing us into the fold with the cases and that. But it is a struggle.
So you've just highlighted once again that with COVID-19, all of us as organizations are really going to relook the way that we've been able to contact our constituencies, been able to work with our constituencies, and find creative and better ways to reach out to people and to determine what our assistance looks like during and post COVID-19. Thank you so much, Myrtle. I'm going to move on next now to Marion Stevens, who is going to speak to us about care work specifically. And Marion is from the SRJC, and she's going to speak to us about the state of care work in South Africa, but more specifically the state of care work in South Africa during COVID-19 and post-COVID-19. Care work in South Africa is still largely under-regulated, not protected, and actually not properly defined in a sense, in that we'll find a lot of South Africans are not really clear what care work is, who conducts care work, and where care work is conducted. And we'll find that in South Africa, we have a very particular socioeconomic context. And so, especially within our Black communities and our communities of color and our poor and disadvantaged communities, we have care work that is conducted both within the private home and within our communities, and it's not recognized, regulated, and so therefore not protected in terms of a rights realization. And so we understand the particular vulnerability that this has had on women, both within their homes and communities during COVID-19. And so Marion, maybe you could just speak to us about the intersecting links between care work, because of the nature of care work being around health, many times within communities, and what those intersecting links and vulnerabilities are during a health global crisis. And so I'll open the floor to Marion now.
Thanks very much, Chrissy, and thanks to comrades at the Women's Legal Center for inviting us in this really important discussion. And I think that Comrade Myrtle has also acknowledged that this is a time where, because we are paused and because we are, in a sense, in a crisis, we're having to really think through and reflect what's really going on. And there is a new normal, and how do we recreate a society that is more equitable and just? And in particular, when reflecting on care work, we do this in the context of patriarchy, and starting off with essentially women. Oh, let me turn on my video. Sorry, excuse me. So as women, as mothers, most, if you look at the language that we use, to father a children is quite a kind of instant thing. It happens. But for mothering, it's a lifetime, and the partnership of parenting is often not well acknowledged. And we know that most families are led by single women, and it's women that are essentially doing this care work. And while we acknowledge that we also live in a heteronormative world that doesn't acknowledge our diverse sexual orientations and gender identities, it's essentially the femmes, trans women as well, who pick up some of this burden of care. So when we're reflecting on homes, and we're stuck in our homes at the moment, where a lot of care happens, essential workers as well, it's this gendered burden of care that mostly women are left with, thinking through food security, thinking through childcare, the tussle that Comrade Myrtle also spoke to about being an essential worker, maybe as a domestic worker. What do you do when you are a mother that's got children that also needs to work? Who looks after the children? When you also have to think through what happens about education, and education is a place of childcare possibly, but it's also a place of food security, where children are being fed, and it's also a place now where children are vulnerable to infection, teachers are vulnerable to infection, and then living in multi-generational homes, the children coming home and knowing that they bear the possibility of infecting their older relatives. And so this is hugely, hugely stressful. How are children also being educated at this moment? And the complexity of accessing these virtual worksheets, whether it's on WhatsApp or whether you're more privileged and your children have access to Zoom calls. But it's extraordinarily difficult, and women mostly at home are thinking and bearing the stress of this. How do you possibly manage this? And then we're thinking of security. So are you secure in your home? And we know that women at home now are exposed to extraordinary levels of gender-based violence. And I think you're picking this up through the media, but also through actual cases being reported to the Women's Legal Centre. If you're an essential worker as a woman, you have to get transport to work. And is that secure? We heard the president talk about taxis and public transport. And what does it actually mean when you put your body in a taxi that's full, that is cold in the winter storm? I mean, Monday was just horrendous. You've got to have the windows open. Is that space clean? How can you be safe? And that is incredibly stressful for people. And it's also cold. And how do you heat your house when we're in the middle of a bone cold, freezing experience on the Highveld in Gauteng, or lashing winds and storms? People are in informal homes, and we're still hearing of people being forcibly removed from their houses, whatever structure that is. In 2020, in this pandemic, people are being removed from housing. And then who's cleaning our houses? And for the middle class, hopefully people are still paying their domestic workers so that they can stay at home safely. But who's doing the domestic work in middle class homes? Who's doing that for domestic workers? All of this is emotional labor and talks to the extent of the gendered burden of care, the care economy within our capitalist society. Chrissy, you also mentioned who defines care and who are the care workers. So we often think about nurses. Are they also sex workers who in the professional ranks are care workers? And so they are positioned in different spaces. And we within the SRJC have had a lot of feedback from some of our nurses, some of our sex workers who are members, and a few from doctors. And there are the usual concerns around the provision of care, but even more amplified now with real challenges when we're learning that our non-communicable diseases are a real risk, and ourselves as domestic workers, nurses and sex workers are at risk when we ourselves have hypertension, high blood pressure, have diabetes, and possibly also at risk of TB or have asthma or some kind of respiratory illness. Mental health illnesses are also an enormous challenge and are being exacerbated, being amplified now as we embrace and have to problem solve being anxious and being stressed in providing for our care, our families and our communities, because we do not live alone just in our houses. We live in streets and or not, and these are real challenges in working towards trust as we work out how to isolate, how to live with corona in our families and communities, and how to support each other in the challenges that we have. The other obvious complexities within women's health in particular are how we are accessing sexual and reproductive health services. And in particular, we are hearing from our providers that women are not coming in for contraception. And so how do we manage health-seeking behavior and our reproductive autonomy when we are nervous to go to the clinic because we might be exposed, but we need to get our contraception? And which contraception are we getting, and what is available in the clinic, because there are stockouts, and we're hearing around the country that there are stockouts of particular services in the Northwest and in Gauteng in particular, also in KwaZulu-Natal. And then abortion services, I'm going to be going into a call later after this one, because there are clinics that have closed in the Northwest, and the nurses, managers there are really upset and very concerned as to how to provide full care. Women also need to address the cancers, and they're living with cancers, and these are issues. Cervical cancer, breast cancer, people are needing treatment. Women who are living with cancer needing treatment have to go. Hospitals are challenged and full, and are places of infection. So these are all terribly difficult to deal with. So one of the issues as well that we need to be working with the Department of Health on is the option of telemedicine, and we've been working to try and make that more practical so that women can phone ahead, can phone for services, possibly for contraception, possibly for access to abortion. This is happening with some international NGOs like Marie Stopes is open to service. But this is a time of opportunity. We see in the Western Cape that there's a kind of international consulting group that has started to deliver chronic meds like your diabetic meds and your blood pressure meds in partnership with the Western Cape. But we need to make this, we need to move very quickly and to make these options available for all women so it's accessible and equitable. So I want to leave that there, and thanks again for inviting me in outlining some of these challenges. Thank you, Chrissy.
Thanks, Marion. And I think just to touch on what you were saying, how simple it actually boils down to and how it is linked to what Myrtle said around the intersecting links of women conducting care work. And as you've mentioned, this gendered burden of care, because I have to go out to work because I'm an essential service worker, yet I have to think about caring for my actual family. So it's not only about my health, but it's about the health I bring back to my family. And it's about the state of women having had to leave their children behind in the cold, having to travel in the cold, having to care for themselves within this patriarchal society we live in, and having to care for others as well within the broader community. And Marion, maybe I can just ask you to, if you would like to highlight any specific interventions that the Sexual Reproductive Justice Coalition has had. I mean, I am aware that you have written to the department as well, or if there are any other specific interventions that you guys have found to be really useful during COVID-19, or that you're thinking of and taking this forward.
I just want to amplify the work of our partners and our members. So yes, we have written within the C19 coalition to look at this option of telemedicine, and it's something that I really want to encourage that we follow up and take forward. We need to also put on the table the stockouts and the shortages of reproductive health commodities. So we are seeing shortages of contraception and shortages of medical abortion drugs. And the other issue as well, which I kind of didn't highlight as much, is the reality that care workers, in particular nurses, are themselves getting sick. So we have a shortage of human resources. We have a shortage of care workers as well. And at the same time, we need to be supporting and acknowledging care workers. So within the coalition, in our kind of support group and working group for referrals, health workers themselves are having to live with their families, going home and isolating because they feel that they have been at risk and they don't want to pass on the infection, and then themselves having to tell people to stay away because the clinic is closed or because they've got stockouts. So it's enormously stressful when you want to be a provider, but the system fails you and you cannot provide. And so that's why telemedicine is possibly a good model, in that that you can provide a level of safety in not having to go into the clinic. I also want to acknowledge the work of Sweat in doing a lot of work around with sex workers, their peer educators, providing for mostly women who are sex workers who fall through the cracks in not having access to the general support grants because they are not, they don't have sex work is criminalized and they don't qualify for UIF, or they possibly don't have IDs or addresses. The other intersecting link is also for queer folks who themselves might be within families. I mean, a lot of queer folks are quite settled in their families, but for some, their families are in lockdown, of violent spaces, and in particular for young folks as well, trying to find their way. And Triangle and other NGOs are providing support for and places of safety for people who are also unhoused. I think, as many of you know, there's a large community of transgender sex workers who live with chronic conditions generally, TB and HIV, and maybe some mental health challenges and also addictions. And now with COVID as well, on top of that, there's an enormous burden of care that NGOs are providing for. And I know if you go on their websites, they are looking for support to provide care packs and this outreach work. And so I really want to support and as an act of solidarity to invite folks to support their work and response work. Thank you, Chrissy.
Thank you very much, Marion. I just want to highlight some comments made by Faiza Davids, who works at, she says our organization, Neverkloof, runs a community advice office in Rieber Castile. And I see that you've made quite a comprehensive comment with regards to both what Myrtle and Marion has highlighted in relation to the lived realities and the different ways that women are discriminated against during COVID-19. And I just want to highlight that you basically said, and I think this is something that we don't realize. We speak about the law, we speak about all of these interventions, but that this is actually a very emotional and stressful time, and that this emotional burden becomes very overwhelming for women during this time. And so I just wanted to highlight that Faiza has been emphasizing this and kind of relating it to their work that they're doing within Neverkloof as well. And for other participants also to just want to read up and see what Neverkloof has been doing, it is in the chat as well. Thank you, Faiza. We're going to go through to the next speaker now, Rosaline Engelbrecht, who is going to be joined by Elizabeth. Rosaline works at the Women on Farms project, and she is joined by an actual woman who works and lives on a farm, Elizabeth. And so they're going to speak to the lived reality of women living and working on farms. And I think this is such a long-standing issue within a South African context. I mean, the reality for farm workers are so vast and contrast within our disposition, within the spatial segregation that we still live in, within especially the Western Cape, but within South Africa, how women living on the peri-urban and in rural communities have such a very different lived reality to women who live within urban areas. And the reality is so different just in relation to geographical context. Having access to basic services, when you're living and working on a farm, you're physically removed from any basic service, such as a clinic, such as a police station, such as a labor department. You find that you are physically removed from any of these spaces where some of us, even though we work as domestic workers, care workers, we actually still live within an urban context. And so it's easier for us to get to a women's legal center. It's easier for us to get to the union just because geographically we are placed closer to it. However, the vulnerability is compounded for farm workers who physically are removed geographically from basic services, but then also have the realization that even if they were wanting to report complaints around the conditions of farm, their work is so intrinsically linked to their tenure security. So you have to balance up, am I going to report a labor issue? But if I report this labor issue, I might lose my tenure security because my shelter is also provided on the farm. And so I think it's quite interesting how we've been going through from Myrtle to Marion, and now we'll speak to Rosaline and Elizabeth, but just the realization of how women experience discrimination so differently based on whether it's the urban, whether it's the rural, your race, your socioeconomic class, and where you are placed. And so I welcome Rosaline and Elizabeth to speak to us more in relation to how we know the conditions are on farms for women who live and work on farms, but how that has been compounded within a COVID-19 context, and what it has looked like in reality for women during these past few months, lockdown and just easing out of lockdown.
Thank you, Chrissy. I don't know if anyone can see us because this room is very dark. I'm so sorry about that. I'm Rosalind.
And I'm Elizabeth.
And I have Elizabeth. She's a farm worker. She lives on a fair trade farm in Stellenbosch. So, which is why I have her here so that she can also talk about her experiences as a seasonal worker on a wine farm. But I'm just broadly going to give some context in terms of okay. Sorry. Is that better? Oh, glad to see you. Yeah. So I'm just gonna give a bit of context
Rosaline, it seems your video is freezing a bit. Do you want to try and maybe switch off the video?
What farm
It seems we're having a bit of connectivity issues just with Rosaline's feed coming through. And it seems we've lost a call. Network and connectivity within South Africa is another struggle that we have. Let's just see if we get her back. Rosaline, can you hear us? Okay, I think what we'll do is we'll try to just contact Rosaline on the side, and maybe we can go on to Puseletso, and then once we've established connectivity with Rosaline, we can bring her back. Hi, Rosaline, are you here?
Yes, I'm back. I'm back.
Okay, we can hear you much better now. So maybe you can start again, continue with your presentation, but just keep your video off for connectivity.
Okay. Okay.
Okay, so you can go ahead.
Thank you. So what I've said previously is that we have seen, and why I want to focus on currently the what this crisis is meant for farm women is because we've seen that COVID has deepened the inequalities and exposed actually that as well. The two key issues that I want to focus on for farm women currently is women's inability to access two key resources of livelihood, one of which was the unemployment benefits, the UIF, and then also the social relief in the form of food parcels. And I know many have mentioned that, but as we know, farm women work only for a certain period during the year. Now, the jobs has even become more insecure. The national minimum wage to casualization and feminization of the workforce. So it meant more women has become seasonally employed. In recent years, it has even increased and workers coming in. So just like women farms also work with migrant women that currently works on farms. But in terms of the unemployment benefits, we know after the season is ended, it is a main source of income during the off season. But when the lockdown was instituted, the labor centers were closed and women were unable to access their UIF. So women were literally left stranded. The Department of Labor was saying that, you know, if women want to have access to their UIF, they have to apply through the electronic devices or online. And we know for farm workers, they're unable to do that. So no other measures were put in place to ensure that the women get access to the UIF as well. And what was victory for women on farms at that period as well, together with the Casual Workers Advice Office and also with ISWI, we've taken the Department of Labor to court, and the victory was that unregistered workers can now also apply. But in terms of the implement to their benefits, that was, I have to say, there was a complete disconnect. The department didn't put any measures in place in order to ensure that women can access those benefits. And due to the nature of employment of seasonal workers, it means that they were excluded from the TERS benefits. So what women was said is that, you know, you're a seasonal worker, so after the season, we know you can access your UIF, your normal UIF, but it doesn't mean you can access TERS. Because it's mainly farmers that applied for the permanent workers. So there was an exclusion for women as well. And even within the 2 weeks of COVID, women were already experiencing hunger. We received numerous calls from the various areas that we work in, where women were saying they were hungry, they don't know how to put food on the table. And we were able to contact Department of Social Development to ensure that there's some form of social relief for them through files. Hi, can everyone still hear me?
We can hear you, Rosaline, but it is fading out a bit with regards to connectivity. But we've been able to hear most of your presentation.
Oh, okay. Okay. So in terms of the social relief, qualifying criteria and assessments mechanisms set out by the DSD did not reflect the difficult period or time in which farm women were finding themselves in. So farm workers should have been eligible to get access to food, no matter whether some of them receive all pay grant or not. They should have been eligible to get access to food, because reason why I say that, during a study that Women on Farms did last year, we have found that 80% of farm workers who are producers of food are experiencing hunger on a routine basis. So it means every month women go hungry, so they will forfeit food for in order to ensure that the rest of the family eat. The assessments that was also done were unnecessarily bureaucratic, and it was impractical for our long conditions as well. It has also meant that there was no safety nets for women, because, you know, with farm women, if I have a family on the next neighboring farm, I'm able to go to my family and ask for food. But because of the restrictions, that safety net was completely lost for women. So women could not access food through family or friends. Um, there was also an increase in food prices, so that has even made it more difficult for women to have access to basic food items. And then farmers were also setting up farms, so asking astronomical prices, even higher than what the shops are asking. So little income that they had, women had to spend on the farm. And then there was also the draconian rule of farmers, where they limited workers' access even when the restrictions were eased. So some women resorted to fishing, shelling it, or exchanging it for other food items. Just in terms of their health, there were not enough adequate resources for women, because when we were asking about the testing centers, because we know on some farms workers tested positive, but there were not enough resources in rural areas in order for women to isolate, or either go to a clinic that's close to them. And all these factors, or all this the drivers of inequality has led also to an increase of GBV. So if the husband come home and there's no food, so he would beat his woman because there is no food, and why are the kids or the family not. I really think one of the things that we need to do is to critique our current system and look at alternatives of a different agroeconomy, that will ensure that the woman's needs and rights are protected and taken care of. I will give over to Elizabeth just to share some of her experience. I don't know if we still have time, Chrissy.
That's fine. We can hear from Elizabeth.
Okay.
Okay, sorry. My naam is Elizabeth. Ik blijf op mijn schoolplaats. Voor ons in die lockdown, toen die virus dan uitbreek, was het een baie moeilijke ding voor ons geweest. Want onze werken was klaar, dat was die kosie. Ons het gestruggeld, want dat was baie moeilijk. Want ons is 'n klomp mense op 'n plaas, 'n gemeenskapie, waar daar klomp kinders is en nou is daar nie kosie. So jy weet nie hoe om te maak, wat sê jy vir die kind in die aand, daar is nie nou iets op die tafel nie, en die plaasouers, hulle het lekker gehad, want hulle het geld gehad, ons het nie gehad nie. En as jy ook sien hoe lekker hulle braai, dink jy ook vir jouself, Here, ek wens dat die Here net iets kan gestuur het vir die kinders om te eet. Ja, hulle het so party telefoons, bakkies gegee met soep wat net genoeg is vir die kinders. So ons is miskien 6 in 'n huis en daai kinders van hy eet, so ons wat die ouers is, moet maar sonder dit bly. En dis moeilik vir ons om by klinieke uit te kom, want daar is die transformation, daar is die transfusie, en ons het baie swaar. En ek dink ons het die woman of farm mense vir Rosalind het ek baie gepla, because die werkers op my vra, wanneer kom daar kos, wanneer sal iemand vir ons kos gee, wanneer gaan ons dit kry en daai kry, en ek het die antwoord vir niemand, want ons almal sit in een ding. En ek dink toe vir Rosalind, en ons is baie dankbaar geweest dat ons met hulle kon praat oor die ding dat ons plaas in verdrukking is, vir ons vroue en die kinders. Daar is die kosie vir die hele 3 maande. Ons weet nie wat om te maak nie. Wat sê ons vir die kinders nie? Want dit is elke dag dieselfde ding. En ek dink hulle het besigheid dat hulle gepraat het met Womxn. Ons is te danke aan Womxn met ons dan 'n hamper gekry waarvan ons families kan geëet het. En ons nog steeds in drukking, maar ons is dankbaar dat dinge bietjie verlig deur die woman of farm wat dan sal help, maar ons sal ook bly wees as daar help uitkom, because ons kry dan nog nie werk nie. Dit is moeilik met hierdie virus wat buite is. Ons moet aan ons kinders dink en aan ons gesinne vir voedsel wat ons nie kan in die hande kry nie.
Chrissy?
Thank you very much, Rosaline and Elizabeth. I know that Elizabeth was speaking Afrikaans, so maybe I can just translate quickly for everyone else who was on the call, just to highlight that what she said was that it was an extremely difficult time for all for all farm workers who were living on farms. And she says that it proved really difficult, especially in relation to food security. As Rosaline has mentioned, the feminization of farm work is that women who work on farms work seasonal work. And so the lockdown came at a time where work had ended also for the seasonal workers, and they struggled to access benefits such as the UIF benefits and social relief. And I think what's very important about what Rosaline said is that she highlighted once again what Myrtle started off the call with, saying that they had this labor victory for unregistered workers. So you have a victory in law, and there's the law on paper, but in reality, there was no implementation of that because the qualifying criteria was not realistic. And so Elizabeth was highlighting how, in reality, in a farming community, you have a little community of people who live on farms with maybe 6 people who live in a home and struggle with regards to food security more specifically. So women are not even able to focus on health, able to focus on work, able to focus on anything else because of food insecurity, and how children were left hungry living on farms. And even where there were soup that was handed out, it would only be enough for maybe the children within the homes, and the parents were not able to then and had to take a step back just so that the children could eat. So thank you very much, Rosaline, and especially Elizabeth, because I think that highlighted to us, as much as we're able to speak to some of the factors that we know about, that we read about, that we hear about, but Elizabeth really brought the lived reality to us to say, you know, as much as we speak about health, law, other procedures, when it comes down to it, and during this lockdown period, food insecurity posed one of the biggest health risks to many poor and marginalized communities within South Africa. So thank you so much, Rosaline and Elizabeth, for your presentation. Now we're going to move on to Puseletso, who works at the Casual Workers Advice Office, but more specifically the Samunia Workers Forum. And we're going to speak to another category of work now in relation to women, but we know that we live in a capitalist society where oftentimes our economy and the capital is put before the livelihoods and the well-being of women within South Africa. And even during this period of COVID-19, the economy largely relied on women working as casual workers, working in factories, working on the front line within South Africa. And so, Puseletso, if you could just also speak to this category of women and how COVID-19 has impacted these women and how they have continued to work during the lockdown. How was their safety ensured? What was the lived reality for this category of women?
Okay. Good morning, and thank you for the invitation. Is my voice clear? Okay. I'm Puseletso from the Casual Workers Advice Office and Simunye Workers Forum. And what I can say about this, how this has affected workers, casual workers, women in particular, is that women have faced a lot of difficulties through this time because we have had more calls from casual workers, especially female workers, telling us about the oppression, the threats, the intimidation they are facing from their bosses. Workers are complaining that even after it was said that the bosses should apply for the test, the bosses did apply for the test, but it never got to the workers. Most of the time, it never gets to the workers. And if it does, sometimes you find that it's not what is expected or what was given to the bosses. You find that the bosses were given a certain amount, but when it comes to the workers, it's a different amount, which is less. Or you find that the bosses are applying for the test money, but giving it to other workers, like they'll be having casual workers working, then they apply in the names of the permanent workers, then they take the test money from the permanent workers and try to pay the casual workers. So that's one of the problems that we've had from the casual workers. And the fact that the country was hit by this pandemic unexpectedly, some companies took this as opportunity to get rid of mostly female casual workers, because we had the most many 198 cases, the deeming cases that came in. So after that, the bosses have been trying to find ways of getting rid of people. So this gave them an opportunity to come up with excuses that the company are facing difficulties through this time, so they had to retrench. And the first on the list was obviously female casual workers or female permanent workers. And this hit them hard because it was not easy from the beginning. Before the pandemic, the working conditions were not easy for them. They were working under oppression, under the male supremacy. Like the male still felt like women are subjected to or I can say women are seen as sexual beings. So you'd find that male people are male bosses or male supervisors, I can say, are using that to look down to the female workers. Like we had issues of sexual harassment where bosses were promising female workers promotion only in return of the sexual favors. So those are the problems that we've had before the pandemic, but now that has increased because they saw this as an opportunity to oppress the female workers even harder, depriving them of the money or opportunities that they were even depriving them even more of these opportunities which were previously still being deprived. Like women were considered were not considered as leaders, especially in the factories. Most of the people that come into our offices are factory workers. So when you are a woman and work in a factory, they don't see you as a leader. So those were the problems we had before this pandemic. But now that there's this pandemic, they are using it even much worse against this women to oppress them, to make them feel like they're putting them in their place, which we don't understand when they say they're putting them in their place. Where is the woman's place? Because when we check, women are the ones that are building these companies. Women are the ones who are making these companies better working places. So we've had challenges with, with women coming in telling us about different problems, because there are even other companies would be told that there are people who are testing positive, they are not getting enough PPEs at work, and the bosses are treating them even worse than before, making sure that they shut them down, that they can't speak for themselves. Because when you speak in the spaces, the factories, you are putting yourself in the lines of being fired, because there's constant intimidation, being told that if you don't appreciate whatever we give to you, then you stand the chance of being fired. That's simple as that. No one will take whatever you have to say, or you can't stand against this company because this company is a big company, it has money. I was also in a situation whereby I was working for a certain company, Pioneer Foods. So we were told that you never have to say anything as a casual worker. It's either you do as you're told or you are fired. And this was happening mostly to us as female casual workers. We knew that if the supervisor asks you for sexual favors and you refuse, you are in the lines of being fired. And we knew that if the supervisor says something and you question that, you are in the lines of being fired. So excuse me a little bit. Okay. So we never challenged that, because we knew that if you challenge the supervisors or say something, you are in the lines of being fired. So the challenges that women are facing right now, besides that, the fact that their hours have been cut short, and their pay, obviously when the hours are being cut short, their pays will be deducted as well. Sorry. So besides the pay cuts that are being implemented, there are threats of being fired, and this affects mostly women, because we are told that the factories are a place for a man. You will be told that women are forever sick, women are forever moody, women have period moods and whatnot, and the factory is suffering because of that. we'll be told that women give birth and they'll want sick leaves and yeah, and all that. Like they'll make excuses that women are feminine. We cry about carrying things. We cry about like we as women are facing more attacks from our bosses because of being women, because they feel that being a man gives them power to rule over us. So those challenges have impacted women to lose their voices, because when they come to the casual workers advice office, it's always the problem of saying that the male bosses, it's never the female bosses, but the male bosses are oppressing us, the male bosses are exploiting us, the male bosses are expecting a sexual favor. So these women are dealing with a lot of issues. It's not only financially, but even now in the times of the COVID, you'll be surprised that there are bosses who still expect sexual favors from workers, knowing that there's this pandemic which is spreading, which is we are not sure about how it's spread, but they're still doing this to women. And you ask yourself that where are we going as a country if we have such leaders leading women and oppressing and exploiting women and are not willing to change that? They believe that it will be like, it is like this, it was like this, and it should remain like this. So I think I don't know, but those are mostly the problems that the workers come with. And even yesterday we were at the Department of Labor in the head office at Pretoria. We had a memorandum. We went there to demonstrate because workers were saying enough is enough. The labor is supposed to be for the workers. The labor department is supposed to be for the workers. But recently the labor department, even the CCMA, seems to be on the boss's side. They say one thing but do another. They say we protect the workers, but when they meet with the bosses, they turn against the workers and side with the bosses. So we wanted to demonstrate and tell them that we've had enough of that. It's high time that the minister understands that we've had enough of being exploited at work and being oppressed still by the labor department. So that needs to be changed. And we're waiting for the memorandum to be handed to the minister. And as we said yesterday, this was only a demonstration, but till things get better, we will be back at the Department of Labor to still continue fight for the rights, especially for the female workers. Thank you.
Thank you so much, Priscilla. So I think you've highlighted quite a few further intersectionalities for us in relation to the discrimination that women faces. And I think it's something that has really streamed through the presentations by all of our speakers, which is this idea that not only are you a woman, but you're a woman of color. You're a woman of color who comes from a specific socioeconomic background. So you're a woman of color who might be a lesbian woman, trans woman, and you have all of these different identities to you. And this compounds how you experience discrimination in the workplace. But another thing that you've highlighted for us is this issue of sexual harassment, work being exchanged as a commodity for sexual favors in light of a health pandemic, and that's even becoming worse. And one thing I think that feeds throughout all of these different categories of workers is the fear of standing up or speaking out against such conduct, because I would rather as a woman go through the treatment than to not be able to provide for my family and for the food. And once again, Faiza has also made a comment where she agrees and highlights all of the things that Puseletso says, but says at the end that women feel so disempowered and have trust issues. And that's the reality of it. Like you said, you guys went to the Department of Labor yesterday. The reality is that women are faced with trying to access the law, trying to access justice, and then having received so much pushback within the legal system, within how the justice system operates, and so find themselves having to deal with this treatment and this behavior within the workplace just so that they're able to secure their work and so that they're able to provide food for their family. Because once again, if I'm a woman and I'm having to provide at home, when I get home and there's no food, I then have to suffer the risk of domestic violence from my partner at home because there is no food on the table. And it's the reality that women face that men do not face within the society that we live in, within the patriarchal nature of how within a work environment, women are still seen as burdens because they bear children, they have their menstrual cycle every month, and because of so many other care factors that come with being a woman. Puseletso, one thing I wanted to also just ask you, which I did earlier for Myrtle as well, is just because you work with a forum and a constituency of workers, how during COVID-19, since we've been on lockdown and since so much resource and access has been cut off, how has the workers been able to continue to be in contact with you, and how have you worked to keep the constituency active and informed and to have resources provided to them? What are some of the measures that you guys have put in place?
Okay. Since this pandemic hit us, we have tried to. We previously had our general meetings every fortnight on a Saturday, but due to this, we had to move our meetings to Zoom because we couldn't travel to the office because we are coming from different places. Like I'm from Pretoria and the office is in Jamestown. So we have our meetings via Zoom every Saturday. And there were pamphlets that were distributed. I've got 3 or 4 of them with me here. Oh, it's 5 of them that we tried to distribute in our different areas. The office were printing out information on pamphlets, like the one that I have is COVID-19 directive on health and safety. And there was the one which was boycotting the reopening of schools. There was another one on law saying law says bosses must apply for tests to pay workers who lose wages during lockdown. And another one, it's on health and safety again. So we've been trying to make pamphlets and distribute them in different areas. Unfortunately, we were only able to distribute around Gauteng at the moment, but we also have them on our phones, and we try to distribute them on different social media spaces. So like Facebook, CWAO has a Facebook page, and they paste this information, and we try that we also share this information via our own Facebooks and WhatsApp. We also have a WhatsApp group that we share this information. Then whoever chooses to do so can share it with their family and friends. And the office has opened, I think it was last month. It's open, but we are taking necessary safety measures like the social distancing. We allow only a certain number of people to come into the office, but that doesn't mean that if we have maybe 5 people in the office, that means you have to go back. No, you can wait outside. We attend the few that's in, then you can come in whenever the others leave the office. So we've tried to not shut down the office completely, but to make sure that even during this time, because there have been many cases which were opened at the CCMA. So we saw a need that, because we know that CCMA is also corrupt, I can say, because many of the cases that we've been attending to were lost unjustifiably. So we saw that the CCMA is not actually working for the workers. So we saw the need that we keep the office running so that people can come to us for advice. Then we advise them however we can. And when they go for their cases, we can also try to assist in whatever way, like whatever information they need. We are there by the office. They can call us anytime during office hours, then we'll be able to assist.
Okay, thank you so much. I ended off with this question basically just to highlight that for us, for example, as the Women's Legal Center, we've had to realize that assistance during COVID-19 might look very different. And yes, even though we are a feminist law center, being a feminist law center, we've had to kind of re-look at the way we conduct business, at the way we conduct our services. We have been working remotely, but we have had to try and think about how we're best placed to serve women within South Africa within a COVID-19 context. And that's why this webinar is also so important, because one thing that I've picked up from all of the organizations is that many of us have had to change the way we work. And even though we were providing a specific service, that service might not be best placed for women. And I think that's the true feminist question. And in the way we're going to end of this webinar and what we walk away from is, what does the service, what does the protection, what does the recognition for women look like best placed during COVID-19? And the harsh reality of even having a webinar such as this today is that many people who attend a call and have access to webinars have access to certain things like internet, data, a computer device. Many women who we are talking about today within these categories of work in conditions where they are far removed from these services, from the network, from the data, from the device, from being able to access Facebook and being able to access a webinar. And so the question I want to end off today's webinar with, and I'm wanting to ask each speaker to please just in 1 minute, give us either what you think is a suggestion or an idea, but I wanted us just to speak to, because all of you guys have mentioned how there have been government measures that have been put in place, maybe in relation to UIF TERS, but that this has not actually been realized for women on the ground because of this access, because of data. Raj Badal, one of the participants, has even suggested, why don't we do a nationwide mass mobilization for one day? What I want to ask to every speaker here, and you can have 1 minute, and we're going to go in the sequence that we spoke to. So we'll start with Myrtle, to just basically say to us, what does feminist solidarity and support look like during and post COVID-19 and lockdown? All of us know the work of the unions, the forums, Women's Legal Center, but from your perspective within the domain and the category of workers you work with, what does feminist solidarity, Myrtle, so you can go first, just in 1 minute, what does this look like going forward? How do we best support each other as partners and coalition and networks? But how do we make sure that our efforts and our support is focused to women on the ground and is effective and implementable to the women that we are speaking about today? So Myrtle, if you could just go first, please, on any suggestions on what this feminist solidarity and approach could look like. And we'd be taking ideas through the comments and the chats as well.
Yeah, thank you. I think, through this whole period, something that's been coming very strong to our mind is the women's solidarity. It is the support of, we have so many WhatsApp groups of women, Shalaf Fuba, all kinds of women, Solidarity 19. There's a lot of women, groups, but what we should ask is, what are we actually giving to the women up there? How can we actually form a strong bond? Like actually also, like we say, the Women Legal Center. If the CCMA and if the labor is not assisting us, how can we reach out to the Women Legal Center? How can we work together to make sure that domestic workers and all vulnerable workers, because what I've noticed here today, we all link up. We all have the same problem. We all have a technology problem. We all have a data problem. We all have an abuse problem. But if we're not going to put our voices, yes, to have a mass action, but is it going to reach the labor? Is it going to reach the CCMA? Is it going to reach those people that sit up there and make the laws for us? So my appeal here would be today is, can we really work together? Can we really strengthen, the bond that we have? Can we really look forward? Because I just want to say this something. An employer say to a worker, you have to now have your own wash basin outside. You must not wash your washing into our machine. You must have your own food. What does that teach us? It's taking us back to apartheid. It's taking us back to this woman. She needs to work. So they saying to her, you decide, do you want to have that separate access outside or you want to stay at home? So yes, we need to make our voices heard. We need to make that labor laws becoming a reality. And we also have to stand that care work and domestic workers are together because the domestic workers are also doing care work. So this is my message. Let us call all the feminist movements, let us call all the organizations, and let us find one voice on how we're going to strengthen the support for the vulnerable sector. Thank you.
Thank you so much, Myrtle. Thank you very much. I'll ask Marian just to pick up.
Thanks very much, comrades. I think for us, what has become absolutely clear is that we really have to think through who the essential workers are and how women in particular are placed. This is what the epidemic has shown us. And it's a reflection of power and how who's usually seen, the professional class who are usually seen as the most powerful, actually it's changed. The people who are holding our society together are the women who are serving us, whether it's doing essential care work, health workers, domestic workers, service workers, people who are producing food. And this is very, very, very different. And so there's a whole change in mindset. And I think while we think through new ways of organizing, for me, where I'm positioned, I know that I need to listen a lot more and listen and reflect to us as a women's movement, perhaps in the country, and to be informed in how we organize. And I think for me, what is absolutely clear is how we're going to have to think about how we organize locally in our communities and partner with other communities to strengthen solidarity, because we're going to be in this position for a long time. And I think that what is really required, let me say it again, is really deep reflection, really deep analysis. Things are not the same as normal, and power has shifted, and power is in the hands of essential workers, and we need to support and work through very carefully how our society is transformed and reorganized to center essential workers and the people who are holding the burden of care and supporting us as we feed our families, as we nurture our families, as we educate our families, as we provide healthcare for our families in this new way of being. And thanks again so much to the Women's Legal Centre for organizing this and for your support. Thank you.
Thank you very much, Marian. We'll hand over to Rosaline on any suggestions on how we build forward the solidarity, feminist solidarity, and strengthening and support to women on the ground.
Thank you, Chrissy. I think one of the things that's also important, we've always felt that there's some disconnect between urban and rural as well. So it's to connect our struggles and create those feminist spaces where we can engage politically, that we can engage on our different experiences. We all come from different backgrounds, different experiences, share those and look at feminist solutions, because we need to be the people that can drive the change. We must infiltrate those spaces, those power spaces, those patriarchal spaces, and carry forward the feminist agenda as well. And the only way we can do that is if we connect our struggles and if we start to create those feminist spaces. Because I think one of the things is that women don't often talk enough about their experiences. Women don't often celebrate even their achievements enough. And I just want to bridge those gap between urban and rural, because we are all women. We all come with different life experiences as well.
Thank you, Rosaline. I think that's very well put and great. I just want to add as well from Bernice Ruland, who said that another recommendation for a way forward is through community gardens as site of organizing women at a local level. If we grow food, we grow community and we grow solidarity. So that's just another suggestion from the floor as well. And then just to our last speaker, Puseletso, what are some of the suggestions or inputs or guidance you can give us on how we build going forward through feminist solidarity in supporting women?
I believe in a slogan that I once heard that we should tell ourselves as activists, especially, that there should be nothing for us without us. So whatever decisions that are made for us, they should be made with us. We should be included in making those decisions. So I believe that we as a feminist organization should rethink or re-strategize on the way we organize ourselves. We should reflect on ourselves and introspect ourselves, check where we went wrong and what we could fix, and how we could organize better in the future, and how do we involve not only certain areas, because the problem we have right now is that there are areas, like I'm in Pretoria, I don't know of any organizations that exist in Pretoria, especially feminist organization. We only hear about them when we have the if enough is not enough, or the not in my name, which only comes up whenever there's an issue like the femicide. There's this issue of femicide, so we see people marching now. But besides that, when everything seems to be okay, there are no organizations doing anything. So we need to check ourselves and not only be present when there's an issue, but continue to build each other, to build to collaborate our organizations, our feminist organization, to visit each other, to know what the certain area is suffering from, or the struggles are, and maybe we can have an input on that, or we could help with that. Because it doesn't help to say I'm in Gauteng and I will only concentrate on problems that are affecting Gauteng. There are problems which are in Eastern Cape, which maybe I can have an input, or I can have a solution for. And there are problems in Bloemfontein that maybe someone might be able to help from a different province. So I think that we as feminist forums or organizations need to mobilize in a way that we can include and build solidarity amongst us, and not be separated and think that, okay, this only deals with the legal issues, this deals only with the domestic issues. But we built one organization which deals with every situation of struggle that is faced by women in the whole country. Then we come up with solutions like that, because as we say, divided we fall, but united we rise. So that's the suggestion I have. Thank you.
So much. Thank you. Thank you to all of our speakers who have so well and succinctly highlighted to us the lived reality, the discrimination and the vulnerability that so many women face being essential care services throughout this time, throughout COVID-19. And I think as the Women's Legal Center going forward, and I applaud all of the participants and those who are watching live on Facebook and everyone who has attended, I think that these last suggestions by all of our speakers have been so important, and we take away some of the main points, which is just that going forward, we realize that women need different types of interventions. No one woman is the same, and no one woman experiences discrimination in the same way. So moving forward, that we work together, we bring our struggles together, because a domestic worker is not just a domestic worker, a care worker is not just a care worker, a farm worker is not just a farm worker, a factory worker is not just a factory worker. All of these workers experience discrimination in the same way, but also in a very different way based on their lived reality. And so going forward, as the Women's Legal Center, we hope we're able to build with all of the organizations, the participants who've attended today, and that we are able to create a network going forward, that we don't work in silos, but that we actually work together, and we're able to highlight the different lived realities. And like our speakers have said, we work together, we bring together the struggles from both an urban and a rural context, that we're able to link issues across different geographical spaces within South Africa, and that we're able to work together as feminists, within solidarity, to highlight these issues and support each other going forward, but that we also, as our speakers have highlighted, make sure that our interventions are informed by the women on the ground. Let's not work top down. Let's not be like the government, who puts laws into place or puts measures into place that are not informed by women. But let us be the leaders within our feminist solidarity, and let's work from the ground up, so that we're able to say these interventions, these organizing, these measures put in place are informed by the women on the ground, and that we are able to uplift and assist those women to make decisions and to take on action for themselves. So I thank everyone who've attended today. I thank all of our speakers who have been giving us such insightful advice and guidance on the lived reality for women. But I also really want to thank all of our participants who have been engaging with us, who have been giving comments, who have been giving questions, and who've just been in solidarity with us throughout this call. We appreciate all of you for attending. We appreciate you for giving your time. And we want to thank you and wish you the best in the rest of the day, for everyone to stay healthy, stay safe during this time, and that we keep in contact. We now have the networks. We now are able to build going forward from this platform, and that we keep in touch and build going forward. So thank you very much to everyone for taking your time this morning. Enjoy the rest of your afternoon. Stay safe, stay warm, stay healthy as best as you can. Thank you very much.